Speech and language therapists are the profession who assess eating and drinking difficulties. When a carer, a GP, a health professional, or even the client notice difficulties with their swallowing, they'll normally make a referral to our team. A referral is a letter to our team asking whether we can come out and help. When we receive the referral, we'll often pick up the phone and speak to a family member or carer about the problems that the client is having. We'll often ask lots of questions to find out how the client is struggling and with what foods, and also to arrange an appointment to come and see the client. When we phone up, we'll often give some advice over the phone to ensure the client is eating and drinking safely before our appointment. When we come out and see the client, we'll come and speak to carers and the client about the problems that they're having. We'll ask lots of questions and ask to see the client's medical records, medication records, and their current guidelines if these are in place. Once we've asked all the questions, we'll come and spend some time with the client, watching them have something to eat and drink. When we're doing this, we are looking for signs of difficulties with their eating and drinking. From watching for these signs, we will then decide what food texture will be safe for the client to eat. If the client is having no problems, we will often write some guidelines and allow them to stay on their current diet. However, if we notice they are having problems, we'll make some changes to the food, the drink, the position, or even the utensils. We'll make these changes to keep the client safe and well. It is important that when we make these changes that they are followed. This will help keep the client safe and well. We'll often come back and reassess your eating and drinking and check that you're having no further difficulties. If there are no further difficulties, we will then discharge you from the service. When someone's having problems with their eating and drinking, there are signs that you need to look out for. These signs include choking, coughing during and after a meal, changing colour, this may be going red or even white, eyes watering, changes in the breathing, this can often sound laboured or sound a bit different. Their voice may change quality, sometimes it can sound like they're gargling water and it can sound a bit wet. Meals taking a bit longer than they used to. Some signs that you're having problems with eating and drinking aren't always at meal times. Some of the things to look out for include chest infections, problems going to the toilet, and weight loss. If you notice any of these signs, please speak to your GP. They will then refer you to speech and language therapy for an assessment of your eating and drinking.